guys, this is Manu, physical therapist and Ayurveda herbalist. So this video I'm going to show you knee flexibility or knee bending stretch I like to show a lot of my patients. So especially after acute injury, the knee, if you're missing that range of motion and you want to start or just want to start getting that joint moving a little bit of lubrication and to facilitate circulation, get rid of swelling, this is a good way to stretch out that knee joint. So especially, remember in the acute stage of injury, as I've said in some of my previous videos, we want to do non-weight bearing, non-loading activities in terms of flexibility. So obviously squatting, kneeling, those kind of things are not going to be good because it's just going to compress the joint, load it up, and you're going to have more pain. So using a ball, you can even use a basketball, soccer ball, anything, essentially, any of those balls to work on this exercise. So what we're going to do is, I'm going to show you on my left leg, I'm laying down. All I'm going to do is, my other leg is straight, okay? So just getting used to rolling that ball back and forth first, okay? Getting that bend. You might be restricted up to here, so you work at going back and forth till you start feeling some stretching. Even after quadricep tendon injuries, right? Or the quadricep injuries, you might be missing some bending at that knee because that muscle is just so bound up and tightened up. So this is a good way to oscillate back and forth. Move back here a little bit. So now I can really work at stretching it out. The ball's good because there's no friction with the ball, so it allows you to glide it a lot easier. So you're just rolling back and forth, nice and easy, oscillating, right, for a few minutes. Now, as you get better at it, you want to get a bit of a stronger stretch. You can start to bend the knee, pull it towards you a little bit more. Okay, you can get to the end range. You can hang out for 10-15 seconds, stretch it, and then go back out. Good. And you can even do full extension. So you get to the other direction, make sure you got full extension or straightening of that joint. Right? So if you wanted a bit of a stronger stretch at that joint, use a belt, a towel, rope, anything you can find basically. Loop it around, lower part of that shin. Okay, and I can use my hands. If pulling it back and forth bothers you or you're not able to do that, you can always use your hands to bend that knee and stretch out that joint. So again, I can bring it all the way back and I can bend that knee and I can stretch it. This is non-weight bearing. It really allows that joint to stretch, but also facilitates circulation, okay? And just working at getting rid of some of that swelling and prevents soft tissue thickening and adhesions that form immediately after an injury, okay? So spend time, a few minutes doing that and then reassess and see how does the joint feel. Does it feel better? Does it feel worse? And usually this should not cause you pain. And if you're doing this and you start having a lot of pain, obviously you got to either not push as hard or don't go as far, or if there's something more serious going on and it's not letting the joint bend, you got to get it checked out. All right? So I hope you find that useful. Good way to good early stage of the injury, acute stage of the injury, flexibility exercise. And make sure you leave a comment. Click on the link below and subscribe to the channel. Thanks.